again. In this presentation, I will just talk about it's like on-desk research, preliminary data assessing food safety KAP among women in Somalia in a One Health approach. I will go through introduction, objective, material and method, result, and I will conclude at the end. So when it comes to foodborne, it's a significant global health concern. It also impacts the Sustainable Development Goals and as well as the impact on Agenda 2063, the Africa we want. Specifically, SDG 1, 2, 3, 6, and the aspiration 1, 6, and 7. Almost 600 million fail each year due to consuming food contamination. And that contamination mostly causes microorganisms such as virus and etc. and some chemicals and virions, non-microorganisms. It also causes economic burden, which depletes healthcare system. So there are 5 Ks for safer food according to World Health Organization, which are: we need to keep clean the food, to separate raw and cooked food, and as well as while cooking, to cook thoroughly, and keep food safe temperature, and use clean water and clean raw material as well. In this study from USA, they analyzed top 15 food that cause outbreak, and if you see in that side of this chart, almost products from animal are the largest, and we are the most in our daily food, and it's ignored in everywhere. So why we are doing this? Just food safety is a significance, as I mentioned, and understanding the practice of food handlers may reduce the risk. In Somalia, it faces a unique challenge: food security and access of clean water, even which makes food safety more critical. So this approach, One Health, acknowledges the interconnectedness of all and focusing women because they play a major role in food preparation in the households. So to get to know all their KAP can provide valuable insights. So what we are expecting to contribute our study could identify areas where knowledge practice need improvement, and to get educational intervention and policing. It could highlight some cultural factor influencing food safety, and later provide appropriate interventions. And to use One Health lens, this study could explore potential link between food handling practice, animal environmental health, and household setting. So it's a cross-sectional study conducted this year, February, targeted women in Somalia that are responsible for food preparation. It was a non-probabilistic sampling, around 182 respondents, and we conduct informant consonant. We developed a structured questionnaire that designed specifically for this study, aligned to WHO's 5 Ks that I mentioned previously. And we also incorporated a One Health domain. We divided into 4 categories: human-centric habit, plant-source food handling, animal-source food handling, and kitchen environmental management. So we translate the questionnaire to Somalia for accuracy and clarity, then review with food safety experts to ensure it aligns the object and clear language. And the questionnaire was contained almost 105 questions from different KAP, and it takes 20 to 30 minutes. We collect Google form and analyze it SBSS, and we also analyze it chi-square to see the association. Okay, in our result, for just demographic, the majority of the respondents' age was 20 to 30 years. Their education was university level, that means mostly they were students and unemployed, and they are in less than, when it comes to their home, 500 per month, with a family size 6+. So they get the knowledge source mostly from social media and from health professional authorities. So when it comes to see in depth, for example, KAP related to human-centric environment, proficiency in human-centric food safety was lower. It's almost just 50% of respondents demonstrating commendable knowledge. So if you see that red circles, awareness of important hand washing was high. Recognizing the risk of associated with wearing jewelry during food was lower. People are not aware that may be a source of contamination. So when it comes to animal source, it's almost very low with only 36.8 respondents demonstrating demandable KAP on this part. If you see the three circles, good hygiene practice, pasteurized cow milk was good, but vice versa, a notable portion of respondents admitted consuming almost unpasteurized milk, so which is a very well known in our country. So in these two, KAP related to plant source and environmental source, which almost a very good based on the respondents' knowledge, their attitude and practice. But the one important thing that we could discover is that the attitude of shaving knife on the floor poses a risk of food contamination. Most people are not aware this may be a source of food contamination while they are preparing food. We recommend a tailored intervention to go with One Health approach and to focus on high-risk areas. Thank you.